dear learners, myself Kaudewar dear, and today we are going to learn the topic drug interactions. Objectives of this session. After this session, you will be able to understand the concept of drug interaction, types of drug interaction, and the contents are introduction, definition, types, mechanism, high-risk patients, and last summary. Definition of drug interaction. An interaction is said to occur when the effects of one drug are changed by the presence of other drug, or herb, or food, or drink. Or it is also called as an interaction occurs when pharmacokinetics or pharmacodynamics of drugs are changed. Then types of drug interaction. There are various types of drug interactions such as drug-drug interaction, drug-herbal interactions, drug-food interactions, drug-drink interactions, and pharmacogenetic interactions. These are the various types of drug interactions. First, let's see drug-drug interaction. Drug-drug interaction occurs when a drug interacts or interferes with the another drug. For example, aspirin plus warfarin, which gives a synergistic effect, that is, which produces excessive bleeding. There is another example, that is erythromycin plus warfarin, which increases bleeding. This is a drug-drug interaction. Then drug-food interaction. A drug-food interaction happens when the food you eat affects the ingredients in a medicine you are taking so that the medicine cannot work the way it should. This is drug-food interaction. Mechanism of drug interaction. There are various types of drug interactions and mechanism of drug interactions such as pharmacokinetic interactions, which affect absorption interactions, distribution interactions, metabolism interactions, and excretion. These are the various pharmacokinetic parameters which affects by the drug interactions. Then pharmacodynamic interactions. Pharmacodynamic interactions said to be synergistic interactions and antagonistic interactions. Let us see absorption interactions. How the absorption affects, that is altered pH, altered bacterial flora, and formation of insoluble complexes which alters GI motility. These are the parameters. Then pharmacodynamic interactions. They occur when the effects of a drug are changed due to the presence of another drug at its site of action, either directly on the same receptor or indirectly on the different receptors. For example, these are of two types. First, synergistic interactions, example sulfonamides and trimethoprim. This is a well-known example. And the antagonistic effects or interactions, example warfarin plus vitamin K. Patients in high risk of drug interactions are polypharmacy people, that is older persons or peoples having more like drugs like hepatic disorders, renal disorders, geriatric patients, and genetic factors. These are the various factors which are high risk. And the feature aspects of drug interactions: bringing in more stakeholder groups in the reporting of the drug interactions, need to clear methodology and best practice of reporting to be international level, and increased need of transparency and openness, and to promote product safety awareness, to encourage all healthcare professionals to report suspected drug interactions. And the summary of this topic: definition, we have learned types of drug interactions, mechanism of drug interactions. Thank you.